Welcome back. We heard about our guest today, who is also taking us through about home care. And we heard about Avenue Home Care, where there's a lot of things, training since 1992 and all that. And it's very interesting to learn that. So we will carry on. Maybe before we left, we talked about all that. Then now that we come to the point now to the patient side, who is eligible for such services? Paul.
I will say anyone who has any chronic illness,
Yes.
and the doctor has recommended that you have to undergo through some care at home, is eligible. The other person who is eligible is anyone who is, the geriatric population. We are looking at people who are getting old, and when you get old, there are some conditions that start setting in. The Alzheimer and the Parkinson. These are things that we cannot avoid. At the age of probably 90, it will visit you. You need things that you used to do normally, you can no longer do. So you need to be assisted. You can't bathe yourself. You can't. You can't walk from here, let's say from here to the nearest road next to us. You need to be assisted. Someone needs to assist you feed yourself. Yeah. So this is someone who is still eligible. However, I'm seeing a very unusual trend these days, and I would say this group is also eligible. There's first-time mothers.
Yes.
They have given birth, but they are not sure of how to take care of their babies. And within the people that we have, they are also trained to take care of the children. So we have a unit that's called childcare. So when we discharge you, or when you have been discharged from any other facility, and you feel like you need someone who is professional enough to help you bring up your baby for the first 3 months or so, then we will be able to help you. Such a person is also eligible. We also have kids with special needs, the autistic kids.
Yes.
They are also eligible because we need to watch them closely through an expert who understands the condition and who also understands, this kind of challenges within the places where we live. So all this group of people that I've talked about are eligible, plus other people with underlying conditions. I didn't talk about the diabetes patients. So these are people who are eligible, those who have gone through surgery.
Yes.
So those who have gone through surgery are also eligible. Yeah, because they need to be assisted on how to move here and there. Yeah, but anyone who needs other auxiliary services like the physio, the nutritional services, these are also eligible people because they might not need my doctor, but they have to undergo through some sessions of physiotherapy. So we also have the services with us. Yes.
Interesting. Now, there's something that came up again. Now, mother and child.
Yes.
Mother and child also fall under home care.
Correct.
And how now? I thought it's about sick patients who have terminal illnesses and all that. Now also about people who are getting babies.
So let me tell you, our current mothers are very busy. I think by the virtue that we are in not pursuit for money and get money so that we are able to give quality life to our loved ones.
Yes.
They wouldn't really spend much with their time. So such people would rather invest into someone who is professional enough to take care of the kid up to a particular stage.
Sure.
But like I said, also first-time mothers, there's a lot of anxiety that comes with first-time mothers, not being sure of how to handle the babies because they have not been through this journey before. So they trust someone that has worked in the hospital. And by the way, for your information, when they are discharged, they themselves, they do ask if they can be discharged with the person who took care of them for that first 2 days or 3 days.
Yes.
And these are still our patient attendants
Yes.
who took care of them, but to the caliber of a nurse.
Mm-hmm.
Yes. So that is how mother and child is coming in.
Yes.
Yeah, and in terms of equipment, we are still getting quite a number of them asking us to discharge them with those maternity beds.
Yes.
So we also have these maternity beds that we will still be able to list to you if you need to. Yeah, if you feel like you need this bed to just keep yourself comfortable at your own compound, yeah. So we'll still be able to list them to you.
So it's not about selling. It means that it's for leasing.
Yeah, we can lease. We only lease.
And how do you?
Because most of them, we can still sell,
Yeah.
but a good percentage do not see the value of buying it because you only need it for like a month or so. Yeah, yeah. So buying it, and because buying one bed is costing us a tune of between 200 to 300,000. And if I was to sell the same to you, the market will not be very receptive to this.
Yes.
Yeah.
Now, maybe what are the challenges, especially in terms of offering these services? There must be huge challenges, eh?
A lot.
Yes.
Talking about challenges, there are a lot of challenges. So I will categorize these challenges into social and economical challenges. So in terms of social challenges, let's start with our own staff. You are sending someone to a home that you don't understand.
Of course, yes.
People with different upbringing. So sometimes they end up being molested, sexually harassed.
Yes.
Yeah, so such cases are very difficult to handle, but it is the risk that we undertake.
Yes.
Because we are playing in that industry. Every industry has its own risk. We also have cases where, the robbery, someone was going to report at work very early in the morning, or even leaving work very late at night. And then they are robbed at gunpoint and everything is gone. Some are shot.
Sure.
Yeah, so we have also lost some lives in that line. And thanks to the ladies and the gentlemen of these countries who have lost their lives in the line of duty, just taking care of, patients at the comfort of their homes. And then we also have the economic challenges. This care, like you're looking at it, some people believe that it is expensive. Well, I will say yes and no, because it is in between. Not too cheap, but again, not too expensive. Because not so many people will be able to afford their 1,000 bob per day or the 2,000 bob per day. So we end up losing a bigger percentage who live below the poverty line.
Sure.
Yeah, because if getting just 1,000 bob per day to meet your daily needs of buying bread and milk, of course, priority, they are likely not to spend it on home care, but instead buy the milk and the bread.
Sure.
So the people that we get are a very small percentage, mostly the high net worth individuals, and also those who may be saved knowing that such a thing might happen when they grow old.
Yes, yes.
Yeah, so we also encourage ourselves to save for such a thing, because eventually it might hit on us. But then we also have other challenges like the remoteness. Someone is in Garissa and they desperately need the care. So what do you do? Sometimes we end up losing these people.
Yes.
Because I don't have the right person who can speak the language of that person who is living in Garissa. Then two, there's that distance element. There's no one who is willing to go there.
Yes.
Yeah, so we end up losing these businesses. But maybe later on during this show, I'll be able to show you what are we trying to do as Avenue Home Care to ensure that we are able to reach everyone across the country. So there are a lot of intervention that we are putting in place. Yes. The other challenges that I know that we have is that we send a caregiver or even a nurse to a particular home, and then they bond so well with this family. to a point that they don't want to let him go.
Yes.
So, it is a good thing, but sometimes it denies this caregiver an opportunity to have a taste of other challenges in other homes, because getting a share of these challenges strengthens them to handle anything. But if you attach this one a particular a worker to one home, next time if he gets the opportunity to go to a very harsh family, they might not be able to withstand it. So for me, I consider it a challenge for my staff. I'm more happy when you go through all these other challenges that are available within that industry. It's only through that we are able to bring up a very holistic and someone who is resilient to handle the challenges in this industry.
Yes.
Yeah.
Now, there's something that is coming up, especially from our Twitter.
Yes.
RISPA is asking something. He's asking, and who regulates the home care service? Is it the Nursing Council? Is it the KMPDC? So who is the regulator in this case?
Good question. Thank you, RISPA.
Yes.
Thank you, RISPA, for asking that. I started by saying that in this country, home care is at the nascent stages.
Yes.
So it means we are still swimming in the gray areas, and no regulator is there.
Yes.
The government itself doesn't understand, and I think some committees are being constituted to really look into the operations of this home care.
Yes.
But as it is now, the home care does not have any regulator. However, we have some facilities that operate like home care.
Yes.
And these are facilities that balances between retirement homes and hospital, the elderly care centers. These ones, I think we have regulators. And county government is actually one of their regulators,
Yes.
and KMPD.
Yes. Okay.
Yeah.
Maybe you did not mention the aspect of cost.
Yes.
Cost for the training, cost of that, is it taken care by NHIF and all that, and insurances? Do they recognize this service?
The cost for training.
The cost for training the service providers.
Okay.
That is my question. Number two, the insurance. I mean insurance and all that, NHIF. Do they take care of those bills related to home care?
As it is now, NHIF, to the best of my knowledge, NHIF does not take care of this cost, but they can take care of the equipment.
Yes.
Yeah, because I've seen 2 or 3 cases where NHIF pays for the wheelchair, where someone has put a wheelchair, then it pays.
Yes.
When we train and upskill the CHVs, for example, for the counties,
Yes.
it is the county government that pays this.
Yes.
I think if the affirmative fund is still there, this is where it falls.
Sure.
Yes. So because this is an affirmative exercise. Yeah. So the insurance doesn't pay for that training. Insurance only pays for the health. But when it comes to training and upskilling, these are initiatives of the county government or NGOs or other agencies that feel there's a gap here and we need to upskill these people.
Sure.
We need to add more skill in this. Case in point, we have ever partnered with Cambridge to upskill some of their staffs.
Yes.
In NBU. It was NBU, how to take care of the newborn at the NBU units. Yes.
Maybe there's many questions that are coming in, and one is very touching from Grace Mungai. She's asking about the emotional, because many people, when they are sick and terminal, they have terminal illness, the family tend to be much emotional and to want to move closer to the patient. But now you are sending a service provider for the home care. Now the perception between in this family, having somebody who has to take care of that,
Like a stranger.
like a stranger in between. So the psychological bit of that.
Yeah.
So maybe you can, how do you handle that? Maybe.
Well, I think I'll categorize this as another risk, and this is psychological risk. Not so many families will be able to embrace a stranger, even if they know that you are the only solution to that. For us, what we have been able to do is that when you are signing the contract, because our contract is very clear of what we intend to achieve at the end of it. So that is service level objective. We are not just here to take care of you for the longest time that this person will be living, but we have to tell you what do we intend to achieve with this patient, because the objective is to recover. Yes. So first thing that we do is to tell you, the reason why we are doing this and the reason why we are giving you this person, because we believe is the person who will walk with you this journey. Then we have from time to time to come and ensure that there is that bond, there's a clear communication between that family and us. So there is that psychological support. When we realize that the family is not so very receptive, especially for the cases that you have just mentioned, some illness are just set in, and we are struggling to understand to an extent that we might not welcome a stranger easily. We have our psychotherapist. We have our counselors from Avenue Group that we work with, and we always call upon them to intervene and talk to the family why we are doing this, and eventually it is for the whole good of the entire family.
Interesting. We are taking a short break. Don't forget to reach us on all our social platforms, GBS TV Africa, also our SMS line 21144. See you shortly.